Hi everyone, this is Dr. Emily Howell from Ashbridge's Health Center. Due to some questions about my sewing ergonomics and stretches, somebody was asking about strengthening the upper back. So I'll show some simple stuff that I tend to prescribe to my patients with upper back tension, a lot of desk workers and those of us sewing these masks during COVID, due to weakness sort of in the mid to low back and tightness through the upper traps and neck. That can lead to a lot of tension. So if we can strengthen here as well as through here, you can look at my next endurance exercise video for that. That will help to basically bring you back up here so that these poor muscles aren't worried about your head falling off your neck. Just remember that not all these exercises are for everyone, so please check with your healthcare provider first to see if they're right for you. So the first one I'm going to do, I have a little tiny bit of scoliosis, so I used to have a rib on the right that would go out all the time or lock up. Because of a lot of studying during school. So I found a one-arm row was great for strengthening between my blade and my spine. So what I usually do is I go in a 45-degree angle. You can hold on to a bench. You can even hold on to a doorknob. You're gonna basically from tip to tail be on a nice angle, and you're gonna just use a bottle of water, something very light, 1 to 2 pounds. I'm up to a lot more because I've been training, but this is just demoing a nice gentle one. What you're gonna do is bring your shoulder back and down. Remember, imagine that you have like an invisible ball in your armpit, so that will activate the lower muscles of your shoulder. And then you're just gonna row up and squeeze. And again, your chin is nicely tucked. And you're just gonna row and hold. And you wanna imagine that your blade is wrapping around your rib cage. You can do 12 to 15, 3 sets of this. That gets too easy, you can go up and wait, and of course do both sides. Even if you're just having pain on one side, you want to go for balance. The next one I often recommend, which is a great one, a lot of us prescribe this one, is the wall angel. So usually I have about a nice bend in the knees, I'm nice and strong through the core, and my chin is back against the wall. This is just a great reminder to remind your body where your head is actually supposed to be in terms of your shoulders. It's a lot further back than you can. I would take my ponytail out as well. Then what I have people do is, I'm gonna scooch over a little bit, elbows at 90 degrees. Shoulders are back and down. So again, you're activating that invisible ball under your armpit. And then what I want you to practice is trying to raise your arms without using your traps. It's really hard. It's amazing how much our upper traps really dominate all the time. So try to imagine keeping your hands along the wall, keeping those blades back and down, and then coming back. This helps mobilize your shoulder, but also teach your muscles which ones are supposed to be working as opposed to the ones that want to work. So up and down, that's a great one. The last one, I'm just gonna change the angle of the camera to show you my table. Let's see if I can do it. Whoop. There we go, pardon me. And this is called the Superman or the Superwoman or the Super Person. We like to be gender neutral. So you're gonna lie on your tummy and your arms are here. And then you're gonna do the same motion as the wall angel, but this also works on your neck endurance at the same time. So sliding your arms up as these stay back and down. It's really challenging. It's quite shocking how hard some of these exercises can be. If you add this in combination with one-sided pec stretches, the deep neck flexor video that I posted a week or so ago, if you can work on your deep neck flexors as well as your shoulder stabilizers, then you will actually have the endurance to hold yourself up. And do basically as many repetitions as you can without pain. Again, if you feel pain, stop any of this and please check with your healthcare provider. But a little bit of tension is okay, pain isn't. So you want to be really conscious of that through doing all these exercises. So please let me know if you have any feedback. I always appreciate any of the comments people have, any requests. I have lots of knowledge. I just want to know what interests you. So thanks so much for watching. Stay healthy, take care of each other, and be well.